Hi everyone, my name is Maria Van Kerkhove and I'm with the World Health Organization. I'm the head of a unit responsible for emerging diseases and zoonoses in our Health Emergencies program. Welcome to Module B, where we will be discussing enhanced surveillance and outbreak investigations for emerging respiratory pathogens. By the end of this unit, you will be able to describe what enhanced surveillance is and how to conduct outbreak investigations in different settings. So after a case of an emerging respiratory virus is confirmed, there are several actions that need to happen at the same time to find additional cases and, very importantly, to prevent further spread. This includes actively finding additional cases, conducting thorough case and outbreak investigations, and conducting enhanced surveillance. So let's first talk about active case finding. Active case finding involves a wider search for cases focusing on patients and their visitors in a healthcare facility where the confirmed patient has sought treatment, healthcare providers who care for that patient or who have cleaned the room where an infected patient has been, and social, family, and work contacts of the infected patient. And how you do this is through contact tracing. Contact tracing is where you identify contacts or people of the infected patients, and you need to record certain information to be able to follow them over a certain number of days. This includes their names, their contact and demographic information, the date of the first and last exposure, or the date of contact when the confirmed or probable case was identified, and the date of onset when fever or respiratory symptoms developed. The common exposures and the type of contact with the confirmed or suspect case should also be thoroughly documented for any contacts that become infected. So how does contact tracing for an emerging virus work? If you identify a case in the community, then what you need to do is you need to identify all of the contacts, so that is all of the people who have come into contact with the known case, and monitor them for 14 days. If they don't develop any symptoms over those 14 days, then monitoring can stop. But if some of those contacts do develop symptoms, it's important to isolate them, treat them, and test them for COVID-19. And they need to be cared for until their symptoms resolve. They can be released from healthcare facility once they have 2 negative tests 24 hours apart. Now, if you identify a case in a healthcare facility, you follow the same procedure. You identify all of the contacts of that known case, and you follow them for 14 days. If none of those contacts develop symptoms, then they can finish their monitoring. But if some of those contacts develop symptoms, then you do the same thing. You isolate them, you care for them, and you test them for novel coronavirus. They can be released from hospital once they have 2 negative tests 24 hours apart. The difference between contact tracing in the community versus contact tracing in a healthcare facility is that in a healthcare facility, you have to make sure that amongst the contacts that you identify, that they include healthcare workers. There are many types of outbreak investigations that could be done if you have a cluster or a group of cases, or if you have a larger outbreak of an emerging respiratory pathogen, such as the novel coronavirus. The first thing that's really important to do before you conduct an outbreak investigation is to assemble a multidisciplinary team. And it's important that you have different disciplines on that team so that when you conduct that investigation, you have the right people that could be part of that investigation. These include epidemiologists, clinicians who could provide clinical assessment, laboratorians or virologists who can do biological sample collection and advise on the right types of specimens that can be collected, infection prevention and control specialists, and importantly, risk communication and community engagement specialists. If an outbreak occurs in an area where the exposure of interest happens to be an animal, it's essential that you have animal specialists included in the team. Before deploying, the team should gather as much background information on the outbreak, on the cluster of cases that they can, and assemble the necessary materials and supplies, such as personal protective equipment, specimen collection, and transport materials before the investigation begins, and inform relevant local public health and animal health authorities. There are many public health objectives in conducting investigations. These include identify other cases and quickly detect any human-to-human transmission, to prevent further cases through the identification of potential human, animal, or environmental sources of infection and exposures, risk factors for infection, and the implementation of appropriate prevention and control measures, and also to reduce onward transmissibility and reduce morbidity and mortality through rapid identification, isolation, treatment, and clinical management of cases and the follow-up of contacts. In terms of the investigation objectives and the knowledge objectives, it's important to determine the size and the geographic area for which this virus is transmitting, to determine key epidemiologic, clinical, and virological characteristics for cases, including their clinical presentation, the natural history of disease, the mode or modes of transmission and disease diagnosis, the incubation period, the period of transmissibility, and best practices for treatment. And very importantly, to determine if there's human-to-human transmission of the virus and if that virus has changed. There are different locations where you can conduct an outbreak investigation. The first one we will describe is an outbreak investigation in a healthcare facility, and this would take place in a healthcare facility where a patient visited or was treated. The objective of this investigation in a healthcare setting would be to identify other cases who may have been in contact with the confirmed case or their biological specimens, including other patients, healthcare workers, and visitors. And what we would need to do is to identify how any secondary cases were infected. That is, what were the exposures that resulted in infection? And quickly be able to recommend measures to stop human-to-human transmission. Other important investigations for zoonotic pathogens, such as pathogens that move from animals to human, are animal health and environmental investigations. So investigators in public health and animal health need to work together in a One Health approach with the following objectives: to identify the source of infection from the animals, to measure the extent of infection in people exposed to those animals, especially among live animal workers, and to develop measures to prevent further human infections. It's important that field visits are conducted so that you better understand how animals and humans come in contact with another, and to look at potential human-to-human onward spread. It's important to do field visits at the patient's home and their surroundings to determine if there are any live animals there, to visit live animal markets or slaughterhouses and to see how people come in contact with those animals, and any other place the patient visited in the 14 days prior to symptom onset and where those animals were present. It's also important to conduct enhanced surveillance. General surveillance in the area under investigation, meaning the area where you've identified cases, should be enhanced or increased for at least 1 month, focusing on setting up lab testing in local healthcare facilities, if feasible, and organizing the rapid transfer of specimens to laboratories that can conduct testing, informing local clinicians in the area of the case definition and the need for vigilance to identify further cases, to conduct surveillance for severe acute respiratory illnesses, or SARI, in healthcare facilities in the community, and increase testing of those patients with severe acute respiratory illness at local healthcare facilities. If resources allow, testing for people with milder illness, such as those that have influenza-like illness. Descriptive analyses of cases, so that the data that you collect from these cases should be performed looking at time, person, and place. And what we mean by this is the place, is what is the geographic location of where these cases have been identified. Create maps looking at where individuals either reside or where those individuals have been. The time, what are the dates of symptom onset of the cases that have been identified? Graphing this or put this in tables so that you can better describe the progression of cases that have been identified over time and create an epidemic curve. Person, what are the relationships and the demographic characteristics between the patients that are identified? Using this data, you can calculate key epidemiologic information such as estimating the incubation period, describing transmission patterns, looking at attack rates by age, looking at if there are certain exposures or occupations that are important for transmission, and looking at clinical data. So clinical data will help you better describe the spectrum of illness, so how many of the individuals have mild disease versus severe disease, potentially looking at the proportion of individuals that have pneumonia, and especially understanding which proportion of the cases that have been identified have died. What do you do with all of these analyses? Data is critical for analysis and interpretation. Collecting the information is not enough. You need to do analyses and look at what those results are telling you in terms of the risk of that outbreak and further spread. This information is also important for designing and implementing mitigation measures to prevent either further zoonotic transmission and preventing further human-to-human transmission. It's important that the results of these outbreak investigations are shared with others so that others facing similar outbreaks can learn from your experiences.